Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Well, I want to thank you for joining me today on Aging in Place Strategies and Answers podcast. Today it's my privilege to have Barth Holohan, the president of the Continuum Family of Services. And Continuum began serving seniors way back in 2002. And by adding a Family Partners Adult Day Center and Family Partners Home model to the Family of Services, Continuum has become a leader in dementia care. And the reason why I invited Barth back to talk to us today is because there is a new program that Medicare launched late summer in 2024, this year, and it is called Guide. And Barth is here to tell us more about this valuable program for those that have dementia and the care partners that are caring for them. So if you are listening today, I feel really confident that you know someone or have someone or who has heard a care partner talking about their loved one with dementia. And from the CMS.gov website, they report that in 2023, dementia has affected more than 6.7 million Americans, and that there will probably be another 14 million projected by 2060. Medicare has been collecting data about those who have dementia, and they have found that people with dementia often have other chronic conditions and that they are probably receiving fragmented health care, which is leading to high rates of hospitalization and emergency department visits. I understand that is not a criticism because I often say, if I don't know what to do with my loved one, and not being a nurse or a doctor, they're going to go to the hospital or the emergency room. But those with dementia might also suffer from behavioral health symptoms, and they also might need 24/7 care to live safely. And that's something that Continuum has been doing since 2002. Well, the challenges of managing health care, providing constant support, and dealing with behavioral and psychological plus emotional changes in the person with dementia can be difficult for someone with little to no experience. In other words, the average care partner to navigate. So in today's program, Aging in Place Strategies and Answers, we're going to talk about Medicare's guide program. And this is for those with traditional Medicare. So let's listen. And Barth, I want to thank you for being with me today and sharing this valuable information about this program that Medicare launched. So can you share with us what the guide program is and then who can benefit from this program?
Sure, happy to do it, Linda. Thanks so much for having me. And like you said, I'm super excited about Guide, mainly because obviously you and I have been doing healthcare for a long time, and this is really the first time that Medicare's ever gone into the looking at how to be proactive in the care that it's providing for people. So the reason why Guide started is that CMS was looking at who used the most expensive parts of healthcare the most frequently. And as you said earlier, it tends to be individuals and their caregivers, the individuals who have dementia and their caregivers. And so what they wanted to do is to try to figure out, how does this program work? How could we start to do more proactive care in the care delivery for people with dementia? And so the way this works is that if you have traditional Medicare, you have dementia, you don't live in a nursing home, you're not on hospice, but you can be on palliative care, and you're not in a PACE adult day program, you're eligible for three components of this program. It goes into medical services, which would be telehealth, care navigation, which is someone every month calling the caregiver and their loved one who's helping them, the person with dementia, and just seeing what resources and referrals they might need. And then it's also providing $2,500 towards respite care.
Yes, so very specifically, a person who suffers from dementia and also has traditional Medicare. And so, those of you that have managed care, be aware that there is a care navigator available to you through your managed care program. And so, I would encourage you to reach out if you're hearing this podcast today. We just passed open enrollment. So having an ability to change medical insurance back to traditional Medicare won't happen until next year again. But I just want those with Medicare Advantage not to feel left out in the cold, because you've already got that built into your program. So I was wondering if there's a cost to participate in the guide program, because Medicare is an 80-20 unless you have a supplement. They pay 80%, you pay 20 unless you have a supplement. So my listeners are going to want to know what the costs are going to be to them.
Yes, the nice thing about this is because it's a separate wing within Medicare, and it's just for this pilot. There's no copay, so it's 100% covered. So the telehealth visits that anybody participates in, the care navigation calls that helps families just give them more resources and referrals, and the $2,500 towards respite care strictly go 100% to the person that is benefiting from this with no copay.
Wonderful. And it sounds like a win, right? Because if we're getting fragmented healthcare and we're trying to figure out how to do things, it's nice to have those check-in phone calls. But I'm just wondering if some of my listeners are thinking, well, do I have to give up my neurology visits? Do I have to give up home health? Like, what? There has to be some trick here, Barth, because Medicare doesn't ever give anything for nothing, right? This just doesn't
Correct.
happen. Okay. So let's be honest and share, are they going to have to give up other things that they already have?
Yeah, this whole program started in July of this year, so July of 2024. Our experience has been that this has just been a wonderful program for people with dementia and their caregivers, and it allows everybody to keep their own doctors. So this program is not to replace what people already have. It's allowing them to add in addition to services that will help them, allow them to keep their loved one at home as long as possible, which is most people's desires. So, for instance, if you have Mr. and Mrs. Smith, and Mrs. Smith is the caregiver for Mr. Smith with dementia, if Mr. Smith is sick, the last thing Mrs. Smith wants to do is sit at the clinic for 3 hours with her husband with dementia
Yes.
or go to the ER. So what
Yes.
they were able to do is we're able to set up a doctor's visit for her through over the phone or through a Zoom call. We're able to diagnose and assist, and then we're reaching out to Mr. Smith's PCP and giving them the information, asking them if they would like to carry on with what we found or if they wanted us to do something like that. And so what we find is that a lot of doctors are busy, and so they will defer some of that to us. Say Mr. and Mrs. Smith wants to have her husband see a dermatologist because he has a weird mole on his arm or whatever the case might be. We're able to set up those specialty visits and do that remotely to give advice and counsel to then figure out and help Mrs. Smith figure out what the next steps might be. So again, we're not trying to replace the healthcare system that Mr. and Mrs. Smith have, but what we're able to do is allow them to get a lot of services at home, which then keeps them out of the hospital. It keeps them from having to go to the next level of care because they feel like they have a support system around them to be able to care for them as they're at home.
Yes, and that's what I like to think about this as a wraparound healthcare system, one that isn't fragmented, that is communicating with their PCP, but also that the caregiver is not sitting at home with another stress on their plate wondering, do I go to the emergency room? And then, of course, you call your doctor's office and they say, well, if it's an emergency, call 911. And then you start juggling those balls in the air. Should I, shouldn't I, shouldn't I, shouldn't I? And then as soon as you get there and you're going to be there all day and you have a loved one, it just sounds like the worst idea ever. So having the ability to get into a geropsych doctor easily, having somebody who's running interference for you just sounds like another win for the care partner of someone who has dementia. And it might not be a full-time care partner. I think in our conversations that they could possibly be living in independent living and have
Correct.
this kind of program and also assisted living.
Yes. So they could be an individual home, you could be an independent living, you could also be an assisted living if you have a caregiver that's doing some roles for you in your assisted living facility, or if you're getting the services in your home, and then through the years, if you end up going to a higher level of care, you're able to continue those services where appropriate to that next level of care. So it really just is a service that is offered by Medicare. And if you're forgetful and you have traditional Medicare, it just is a benefit that you have to your disposal. Not that you have to use every aspect of this program. You don't have to use the telehealth if you don't want to. You don't have to use the respite benefit if you don't want to. But the nice thing is that those services are there and you have a team of people at your disposal to help you provide better care to your loved one. And it really just helps people live a lot longer in their environment of choice.
And so Continuum started initially as a model to bring caregivers into the home. And over the years, and as many of you know, I still work for Continuum. I celebrated my 13th anniversary. But we find that caregivers, people who are taking care of those with dementia don't necessarily want another person in their home, which is why you started Family Partners to give respite to people. So you might have a caregiver a couple of days a week, but you also might be going to the adult day program because it's a totally different environment. But a lot of people don't understand what respite is. They know they need something, but they don't know the terminology. So can you share respite? And then let's
Sure.
talk a little bit more about the guide program and what they're able to offer.
So the reason why Guide was started is to really, in my mind, is to come alongside the caregiver who's caring for the person with dementia. It's to give them respite and reprieve and support and ongoing guidance on how to care for their loved one with dementia. So the respite piece can be deployed in three different areas. It can be deployed in private duty home care. It can be deployed in adult day centers, and it can also be spent in a 24/7 retirement community respite program. So if someone's eligible for the guide program and they want to get private duty services in their home or adult day or in a facility, they're able to do so and spend that resource in those three areas.
Wonderful. So having that break or needing that break is huge. And that's where this program can really help someone stay in there for the long haul with their loved ones. So that's
Absolutely.
great. And that $2,500, is that just a one time or is that, when does that renew?
It's a great question. So the $2,500 is every July 1st. So
Okay.
if someone signed up today, between today and July, well, the end of June, you can deploy that $2,500, and then July 1st it renews again, and so you have an additional $2,500. And then there's no cap on the care navigation, and there's no cap on the medical services telehealth piece.
Perfect. Now, we're in Missouri, right? So we know the program is available here because you're providing that under the Continuum brand. But is this a program also available in other states?
Yes, it's actually in all 50 states. We're actually helping deploy Guide in all 50 states. Currently, we're in 36 states. By the end of the year, we'll be in 38 total. And then by the end of the first quarter of 2025, we'll be in all 50 states. So this is something that we can deploy all over the country. That we're excited about helping people be able to get this benefit all over the country because it really is needed. And where we see the gaps is that there's a lot of gaps in the respite piece of this model currently. And so it'll be so nice for us to be able to provide that respite benefit to people all over the country because to me, the medical services piece and the respite piece are really the two bookends of the whole system that with both of those together really help people stay independent in their homes.
So then, how would someone who's listening today get connected to Guide?
Yeah. So all they have to do is just go to our website. It's called guidedementiaprogram.com. And if they go to guidedementiaprogram.com, there's an area for it's a secure site for people to put in my example, if it's Mr. and Mrs. Smith, Mrs. Smith would put her name as the caregiver. She would put Mr. Smith's information in there, would put his Medicare number because we want to check and just make sure that he has traditional Medicare. And then they would put their contact information, and then we would check the Medicare number, reach out to Mrs. Smith, and then start the next steps needed to get Mr. Smith aligned for the guide program.
Wonderful. And I know that when you're listening to podcasts, sometimes you're multitasking. So listeners, don't worry. I'm going to have this contact information, the website, and then how you can access that secure application referral form so that when you have someone that you want to refer, that you can do that easily. So don't worry about that. Barth, is this a 1 year program? Like we've just never, I don't know that I've seen anything like it. And since we just went through open enrollment, my thought process is, well, is this going to change next year? Is this something that's is just popular this year? This is the new thing or what? What do we have a timeline on this program?
No, the nice thing about it is it's not just a couple year program. It's actually a 10-year pilot. You'll hear people say it's an 8-year pilot, but what it is, it's 8 years for people to be able to sign up for Guide. And then they added an additional 2 years for people to receive the services on top of the 8 years. So in total, it's a 10-year program. And I really feel that, Medicare will see significant benefits for the proactive nature of this program. And so, the hope is that over the next 10 years, we'll learn a lot about caring for individuals with dementia and a holistic approach using, Medicare for that delivery as part of those services. And, the goal is hopefully CMS will see that benefit as well and will then continue some form of that program even after the 10 years.
And so it rolled out late July. You already have people in the guide program, right?
Correct. Yep.
So,
So
oh, I was
they
just going
started
to ask.
rolling it out in July of 21, and then they're doing a second wave of providers rolling out in July of 2025. We partnered with a company called Empower Me. They have 1,000 clinics in 38 states that are deploying Guide through their facilities and their communities, and they asked us to help expand the network on the non-facility side of their model. And so that's what we're doing and will be doing in all 50 states, is building the respite network and care navigation network to deploy Guide all over the country.
And I know you've been busy rolling that out, but I'm just going to ask you now, would you mind coming back in a couple of months and updating us on some of the feedback that you've been getting about this Guide program?
Sure, happy to. Thanks so much for having me.
You're welcome, and thanks for being with us today. Listeners, as always, join me again on Aging in Place Strategies and Answers, and thank you for the time you spend with me. Thank you for joining me today. Please remember that this podcast is intended as guidance and not advice. Share this podcast with friends and family who are currently in crisis mode, or with people who would like to start developing their own roadmap for aging in place. Listeners, if you would like a deeper dive into a topic discussed during a podcast, please subscribe to Aging in Place Strategies and Answers, where you will be able to access premium content. Or if you would like to suggest a topic for this podcast, please contact me at linda.agingstrategies@gmail.com. As always, I value the time you spend with me.